Hip and knee osteoarthritis part 4, managing a flare-up and goal setting. So what is a flare-up? A flare-up usually means a period of increased pain, swelling or stiffness. A flare-up can occur due to lack of pacing or not taking your pain medication as prescribed. But it's also important to remember a flare-up can occur for no reason at all, and to experience a flare-up with osteoarthritis is normal. So what can help a flare-up? So active rest can definitely help a flare-up. It's important that we get a little bit more rest when we do have a flare-up of pain, but it's also important to remain active in short periods between this rest. A pain medication review can also help us during these flare-ups. So your GP or pharmacist may decide to change or increase your medication. Relaxation can also be useful during a pain flare-up, and we've discussed this a little more in the third video. Gradually increasing our activity, so we talked a bit about rest and doing little bits of activity between rest, but then gradually building these periods of activities. And then finally, we can use ice and heat therapy during a flare-up, and we'll discuss this a little more in the next slide. Ice and heat can be a good way to relieve painful joints. Is it better to use ice or heat? If the joint looks swollen and red, then ice can be applied for 10 minutes with a damp towel. Otherwise, ice or heat can be used depending on preference. What precautions should be used? If you have any problems with your circulation, reduced sensation, or numbness, you should speak with a healthcare professional prior to use. Always use a towel to cover the area and check the area regularly for burns. So now we're going to discuss a little bit about goal setting. So what is a goal? So a goal is something that you want to do or aim to achieve. So why are goals useful? So goals can be useful to motivate us to improve aspects of our health and well-being. So if you are thinking about setting a goal, using the SMART formula could assist you in achieving your goal. So within the SMART formula, the S stands for specific, so it's choosing a specific goal. The M stands for measurable, so make sure you have something to measure your goal by. The A stands for attainable, so something you've achieved before or something that you think you will be able to achieve. R stands for relevant, so something that's going to be relevant to you or useful for you. And T stands for time-based. So here on the right we have some examples of SMART goals. Example number 1, I would like to be able to walk to the local shop and back within the next 6 weeks. Example number 2, I would like to be able to climb the stairs with increased confidence within the next 3 months. We have now reached the end of the hip and knee osteoarthritis videos. At this point, you may wish to write down any goals you have. It may also be useful to discuss any goals you have with your physiotherapist.